Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane with the Ask Dr. Pane segment, where he will answer your cosmetic surgery questions. And Dr. Pane, our question here is a breast implant revision question. They want to know, should they go over the muscle now? They want an augmented look. The current implants are over 20 years old, and they do a lot of weight training. So, Dr. Pane, what would you recommend in this situation?
Well, here looking at the pictures, it's a fairly typical type of appearance of somebody that has implants a long time. Actually, they look pretty good for 20 years. But because they're a bodybuilder, thick muscles and very thin tissues. Because the implants are already under the muscle, now this is a case that you're going to get a lot of different suggestions on. I would just say flat out, person should consult with someone that is comfortable doing a lot of these secondary revision procedures. Not as many people do it as you might think. So you have to keep that in mind when you're in the consult. Are they telling you something just to tell you something, or do you get the sense that the person does this often, likes doing it, and does that kind of thing a lot, which was what we do. Here, if the implants are already under the muscle, in most cases, you're going to want to keep them under the muscle. The pocket might need to be adjusted. If they want an augmented look, you can use higher profile implants. You can close the pocket laterally so it sticks up more. That is not a big deal. Going on top of the muscle when you're already under the muscle becomes a little trickier because you got to develop that second pocket and then you got to sew down the muscle. And because the person's a bodybuilder and the tissues are real thin, those implants are going to be easier to feel, that they may not be used to that than what they had before. Sometimes a first-time augmentation in a person that's bodybuilder is better off on top of the muscle with the silicone gel for the softer appearance. But that's not 100%. It depends on what your situation is. So for here, I would recommend probably use the same pocket, probably go a little bit larger from what they're telling us in the consult, and might even need a breast lift depending on how lifted they want to be. But they don't absolutely have to do it because it doesn't look like there's a lot of breast ptosis here. So it's an interesting case, and again, needs an in-person consultation to really go over all the fine details. But that's the big overview of what happens in this kind of case. Most of the time, same pocket. Sometimes you can change it, be in the hands of somebody that does this kind of thing a lot. And that way you can get the best chance of getting a nice result with one procedure. So hope that helps, and we'll talk to them next time.
Thank you, Dr. Pane. And if you have a question for the doctor, please visit our website, Facebook page, Instagram, or Twitter. And Dr. Pane, we'll see you on the next question.
Great.